Welcome, everybody. I'm Craig Larson, Executive Director at the Chronic Disease Prevention Alliance of Canada, of CDPAC. I'll be moderating today's webinar. CDPAC is an alliance of Canada's major national health organizations sharing a common vision for an integrated system of research, surveillance, policies, and programs for the promotion of healthy living and the prevention of chronic diseases. To learn more about CDPAC, you can check out our website and connect with us on Twitter, Facebook, and YouTube channels listed at the bottom of this slide. Today's webinar, titled Who is Vulnerable to Household Food Insecurity and What Does This Mean for Policy and Practice, is the second in a series being co-hosted by CDPAC and Valerie Tarasek, Principal Investigator of the PROOF project of the University of Toronto. Today's webinar is intended to bring together practitioners, policymakers, and other stakeholders in healthy living and chronic disease prevention to learn about the results of the PROOF project and to continue the dialogue on how you can put the evidence into action in your own jurisdiction. It's now my pleasure to introduce you to our first speakers, Valerie Tarasek, Professor at University of Toronto and the Principal Investigator of the PROOF project, and Lynn McIntyre, Professor at University of Calgary and a member of the PROOF team. After we hear from Val and Lynn, we'll hear from Pat Vanderkoy, Director of Public Affairs at Dietitians of Canada. Pat is also a director on CDPAC's Board of Directors and a core member of CDPAC's Federal Advocacy Team. So with that, over to you, Val and Lynn.
Thank you, Craig, and welcome everybody to this second webinar. It's wonderful to see so many of you online today. Our focus today is to share with you what we've come to understand about vulnerability to food insecurity in Canada, and through the course of doing that, to try to eke out what we've come to understand as the policy and practice implications of the research that we've been doing. So first, just to review, since 2005, food insecurity has been monitored in Canada using an 18-item module, and on this screen what you're seeing is a summary of those questions. Most of the questions are focused on quantitative deprivation, but there's also a couple of questions about qualitative compromises, so balanced meals or low-cost foods, and this first question is about worry. All of the questions have this clause attached to them to establish that the problems people are reporting relate to them not having enough money to buy the food that they need. So what we're talking about in terms of food insecurity in this webinar is the experience of inadequate or insecure access to food because of financial constraints. We now have 4 years of nationally representative data from the Canadian Community Health Survey on food insecurity in the country. And here you see the findings. What you're seeing are millions of households. So by 2012, 1.7 million households experiencing some level of food insecurity. The bars are graded by the level of severity based on the number of questions people affirmed. What's 1.7 million? Well, that works out to about 12.6% of Canadian households. And if we look at who's living in those households, by our best calculation, we're talking about more than 4 million Canadians being exposed to some level of food insecurity. And that is a very significant increase since 2007, an increase of more than 600,000. Geographically, there's huge variation in the prevalence of food insecurity. An extraordinarily and appallingly high level of food insecurity in Nunavut. Here you're seeing from 2012, 45%. But also high levels in the other territories and in the maritime provinces. But importantly, nowhere in Canada have we yet to see a prevalence of food insecurity that's even as low as 10%. In 2012, our low province was Alberta at 11.5%, but we have a significant problem of food insecurity in this country everywhere, but with these particular pockets of vulnerability. Another way to look at the distribution of food insecurity geographically is this slide. Here we're showing you where those food insecure households live. And while, if you look at the very bottom of the slide, Nunavut, while Nunavut has the highest prevalence of food insecurity in the country with 45% in 2012 being food insecure, it actually has a very low number just because the population there is quite low. So 84% of food insecure households in Canada are living in these 4 provinces that are highlighted in red.
So now let's look at who's actually food insecure from other types of demographics than just the geography of where people live and these densities of prevalence of food insecurity. So this is quite a well-known slide on the household composition of food insecurity. And so it's very remarkable, of course, and not a surprise to those that have even dialed in today, is that we have about a third of female lone parent-led households that are reporting some level of household food insecurity. And then we have the variations to as low as 5 and 6% when you're talking about couples with older children or with no children. And look there again at the elderly living alone have actually quite a low rate of household food insecurity. So let's turn next to the really important issue of children. So this is what has really animated advocates around household food insecurity, is actually the disproportionate vulnerability of children in food insecure households. So 1 in 6 children in Canada live in a household that is affected by food insecurity. Now, as we know, there's a protection of usually the parents in terms of the child's experience, but nevertheless, this is an important adverse effect. And then the extraordinary vulnerability of children in Nunavut, with over 2/3 of those children being in food insecure households. And again, across the country, we have very, very high rates. I mean, a third there in the Yukon territories. And we'll be pointing out that we can't even get below 15% in Canada in one of our better exemplars, which is Newfoundland and Labrador.
One of the other things that we've come to learn from looking at the data in the Canadian Community Health Survey is that food insecurity in this country is racialized. Here you see the rates of household food insecurity from the 2012 Canadian Community Health Survey. And based on simply the self-reported identity of the respondent. And you can see that people who were identified as Aboriginal or identified as Black had much, much higher probability of being food insecure and being severely so. The data we have on Aboriginal respondents in the Canadian Community Health Survey always surfaces a much higher rate. So in 2012, 28.2%. But what's important to recognize is that that's incomplete, because by design, this survey doesn't include people living on First Nations communities or people in some northern remote regions. So we're missing some very significant and vulnerable Indigenous groups. When there have been more focused surveys conducted amongst Inuit communities or First Nations communities, the prevalences of food insecurity that have been identified on the smaller surveys are in the order of 50, 60, 70%. And here I've given you a few examples. So we've got a significant disparity in terms of who's affected by this issue. It's also interesting to take a look at immigration, and I offer this to you because this is an area that we've noticed there's a lot of confusion about. If we simply look at the reports of food insecurity by immigrant status on the Canadian Community Health Survey, what we see is a picture like this graph, whereby those who report being recent immigrants have typically a higher prevalence of food insecurity than those who are Canadian-born or those who have been in the country longer. And I should mention here that in asking about immigration on the Canadian Community Health Survey, we can't identify refugees. So for sure, we would anticipate they would have a slightly different profile than the one I'm showing you, but we don't know what it is. So this is when we simply look at the prevalence. What I'm showing you now is the results of a multivariate analysis to illustrate what happens when we take immigration status and we put it in the context of other household characteristics like income, home ownership, education, the number of children, other sorts of things that also relate to food insecurity. And what you can see with the OR column, and now for those of you who are not statistically inclined, I should say, this is the only one of these kinds of graphs you're going to see. So don't hang up yet. Just hang in. It's going to get, we just have to get past this. But if we look at people who report having immigrated in the last year and we don't consider anything else, or in the last 5 years, they have 1.67 times the odds of food insecurity compared to those of us that are Canadian born. But once we start to put on the table other characteristics of households like income, that prevalence drops so that it drops to 0.72, which what that means is that the probability of someone who is a recent immigrant being food insecure, once we take into account other characteristics, is actually lower. So immigration isn't an independent risk factor for food insecurity. That takes us into a conversation about income, and as you'll see, we've done a lot of thinking and looking at income because household income is the single strongest predictor of food insecurity, which makes sense when you think about those questions that we use to identify people as food insecure, right? People who don't have money for food. Here's the relationship between income and household food insecurity. for 2014. The bottom axis is income adjusted for household size. So we've done that so that we've been able to include single-person households and families of 5. But the picture is very, very consistent that the lower the income, the greater the probability of food insecurity. But what you probably are already noticing about this picture is that if we look at the very bottom end, we never get to 100%. So even with households that have very low levels of income, right, an annual income under 10,000, we're still finding about half of those households reporting to being food secure. If we go higher up to income levels that you would expect to be more than adequate, we still find some low prevalence of food insecurity there. So what's going on? Well, I can tell you this has been the, the preoccupation of some of us for quite some time. And what we've come to figure out is that food insecurity is actually a very sensitive measure of material deprivation in a household. The reason there's a disconnect between food insecurity and income is because it's an even better measure of material deprivation than income is. By the time someone is struggling to put food on the table for themselves and their family, what we're seeing is the product of their income and their assets. And their income, both in terms of the amount of that income relative to need, so the adequacy of it, the stability of it, and the ability of their income to enable them to weather income shocks, so sudden drops in income that relate to perhaps job loss or an unexpected expenditure. So the income is a major part of this story. The other side of this story, though, is assets. And as we go forward in this presentation, we're going to talk more about both of those components that together cause us to create this graph to show this very strong relationship, but a strong but imperfect relationship with just simply dollars coming in. To start that conversation, I want to take a look at main source of income. So here you see the prevalence of household food insecurity for households in the 2014 Canadian Community Health Survey, just simply divided up by main source of income. And you can see a very, very clear picture here, right, whereby the lowest rates of food insecurity are amongst households where the main source of income was a senior's income. The highest rates are amongst those on social assistance. What we've come to understand is that that extremely high rate of food insecurity amongst social assistance recipients, so remember what I'm showing you here is more than 60% of those households are food insecure. We've come to understand that that relates to the very low benefit levels that people on social assistance get, coupled with restrictions on earnings and asset limits. To give you a better feel for where our understanding has come from, I'm showing you this graph. Social assistance is a program that is administered at the provincial or territorial level. And so what you can see is some variation between the provinces and territories in terms of the proportion of social assistance recipients who are food insecure. Most of them are sitting in the 60s or 70%. At times when we look at this Canadian Community Health Survey data, these rates even go above 80%, depending on the province and what's going on in it. But the outlier is our little friend at the bottom here in red, Newfoundland and Labrador. And thank goodness they're an outlier, because by doing a closer look at them, we've been able to understand just how important social assistance program designs are to the rate of food insecurity amongst their recipients. This is the rate of food insecurity amongst people in Newfoundland and Labrador who were receiving social assistance over the years from 2007 to 2012. The rate dropped from about 60% in 2007 to 33.5% in 2012. How come? Over this period, Newfoundland and Labrador rolled out a poverty reduction strategy that included people on social assistance. So they raised the rates, they indexed them to inflation, they lifted the earnings exemptions, they lifted the low-income tax threshold and the liquid asset limits. So they basically did a cascade of things that rolled out over those 5 years, which is why that, or 6 years rather, which is why that line keeps going down. And the changes boiled down to making the material circumstances of people living on social assistance better. And what happened? They're still all poor by anybody's stretch of the imagination, but they're more able to feed themselves and their families. So it's had a profound effect on food insecurity status among social assistance recipients in that province. What's the moral of the story? The very, very high rates of food insecurity that we see across this country among people who are reliant on social assistance are a function of the way those programs are being delivered.
So let's go to the other end of the spectrum then and look at seniors' incomes. And there's a question about whether or not seniors receive social assistance. And the answer is no. And this is a an opportunity to look at a very positive story about the special story of seniors and their incomes. So we have actually done quite a bit of work on looking at the food insecurity rates of those that are near seniors, that's age 55 to 65, and those that are seniors for the purposes of our seniors benefit programs, which are old age security and the guaranteed income supplement, and the 65 to 74 years of age. So this is a quick analysis of the Canadian Community Health Survey for 2007 to 2013. And for the purposes of figuring out how the senior benefit actually might affect food insecurity, we've only taken unattached seniors so that their household income and their personal income is very low at 20,000 or less. Remember that graph, line graph, where 20,000 is really one of the big cutoffs for very high rates of food insecurity. So the first thing you see in this table is that the types of sources of incomes that are used by these very low income near seniors before they're 65 is a mixture of employment insurance, workers' compensation, social assistance, and some employment income. And after age 65, the vast majority of the main source of income actually is derived from the senior benefits, again, the old age security and the guaranteed income supplement. So what we actually see is that you have a birthday cake and a birthday card, and you get your seniors benefit at age 65. And what does that do to food insecurity? So you see the ages on the bottom, and then you see the prevalence of household food insecurity before age 65 for the same group of people as afterwards. And it's about a 50% drop. From about 22% of that near senior group is food insecure, and after age 65, when their eligibility is kicking in for these senior benefits, it drops to about half at 11%. So there are very, very few social policy levers that we have that actually can render a problem 50% less. It's a very, very powerful effect. And you can read more about this in our paper in Canadian Public Policy. So what are the implications then of what we've been presenting at this point? So I think we've been trying to show you that the prevalence of household food insecurity and its severity are reduced by the policy interventions that actually change those material deprivation circumstances through financial support of vulnerable households. And the PROOF research is not the only ones to talk about that. There's a nice paper on the universal child care benefit in 2006 targeted to those children under the age of 6. And it showed, again, a genuine reduction in food insecurity in those recipient households. And then a nice natural experiment of one-time increase in the rates of social assistance in recipients of British Columbia having, again, a reduction in food insecurity. There are other studies, so I think it's very important, as I think the caution of the first webinar said, is that we've been talking about data that comes largely from the Canadian Community Health Survey, which is cross-sectional data and not longitudinal, meaning not following the same households over time. But PROOF has actually had the opportunity to look at some sources of data where you actually can follow households over time. And income is very important to see a household go from a food insecure to a food secure, but also it raises the important issue of employment and employment stability. So I think we have to remind everyone here that while the risk of food insecurity is highest among those with social assistance, the vast majority of those who are food insecure are in the labor market with their wages and their salaries or their self-employment. 62% fully of the food insecure households in Canada are reliant upon wages and the traditional labor market for their income. And so that's over 1 million people. So what does that mean then in terms of how it's distributed? And this is where we're starting to see another sort of challenging questions that need to be provoked. So we do see that it's, again, very high across Canada, but you do see lower in central Canada. And many of the discussions are that may be because of the types of unionized environments or social protections that are afforded to workers in those areas. So when we're taking the issue of how is it that we all think, get a job and then get yourself out of food insecurity, how is it that so many households are reliant on employment income and remain food insecure? So the jobs obviously are not paying enough, right? They're low-wage jobs. But there's also the entire nature of work is changing. So you go from short-term work to part-time work, contingent. So that whole precariousness of the work situation makes people go in and out of reasonable earnings and suffering a lot of the shocks that we've mentioned earlier. And the other thing, of course, is that employers have no obligation to pay somebody on the consideration of how many mouths they're feeding. So when you have multi-person households that are reliant on one earner, or very large households with extended family reliant on only one or two earners, you're actually not able to see enough income to buffer food insecurity. So I think it's important that while we say that the wages are low, the bottom line of the modern and changing workforce is that increasing minimum wages or even the living wage will not alter a fundamental vulnerability that is now strongly emerging and persisting, is that there isn't actually enough work. So while for the workers a minimum wage is a good idea and living wage is even better, it doesn't change the major problem of there's not enough work. So another sort of very complex story around food insecurity is the housing story, and we've mentioned only so far issues of assets. But this is a very important factor in considering vulnerability to household food insecurity. Very simply, renters are far more at risk of food insecurity than homeowners. And here you see the 25% versus the 7%. Another way of putting it is that 64% of all the food insecure households are among renters. That condition is actually representing over almost 2/3 of the food insecurity. And you'll be seeing even in more detail, this is not entirely based on just who rents versus who owns, because we still see this persistent risk of renting as being a very important vulnerability to becoming food insecure. So another area that we've studied is to figure out what accounts for the difference in food insecurity between people who own and people who rent. And so the question is it the type of renters are different sociodemographically because they have lower incomes, lower education, they may be younger, they may be living alone? Or is it that there's something absolutely more systemic about renting versus home ownership? So because we promised not to show you any more difficult statistics, we were able to actually try to tease apart the difference about renters versus homeowners in food insecurity to figure out what proportion of that difference, that gap, which is very significant, is accounted for because of who rents versus who owns. So we found out that 71% of the overall difference is because, in fact, socioeconomically and sociodemographically, they are representing the vulnerable group. Lower education, the household status type of issues that we've shown you before. But still, almost 30% of that gap is not explained by who rents versus who owns. It's explained by the actual protective impact of home ownership over renting. So let's just consider what it is so protective about renting versus home ownership and what protections are lacking in those that are in the rental economy. So for owners, when they own, they have a hedge against inflation. So the very easiest inflation that they're hedging against is big fat rent increases, so that which are usually on an annual basis, right? So they have a 5-year mortgage, let's say, so they can actually protect against inflationary increases, and also they're also having some type of inflationary protection on their asset because they expect their house to appreciate. The other aspect of home ownership is that they have an asset that gives them access to credit. So when there's a shock, with these income shocks such as an unexpected expense, a transient loss of your job or a layoff, you actually can access this credit and not get into a food insecure situation. And all of this is even without us understanding what mortgage indebtedness is contributing. One would expect that highly indebted mortgages would actually put people at a vulnerable state, but it still doesn't seem to be enough to undermine the protection that comes from housing and home ownership. And then finally, we actually have a pro-homeownership policy framework at all levels of government that are actually favoring people and encouraging them, incentivizing them to purchase homes. In fact, even subsidizing many aspects of homeownership, and the renters don't have this type of protection. They don't even have the buffers that basic homeowners have.
We've got one kind of a policy in place that is focused on renters, and that's this notion of subsidized housing. So for sure, we always hear reports of the huge waiting list for people to get into nonprofit or not-for-profit or subsidized housing across the country. But we've recently been able to do a little piece of work to see just what subsidized housing does. And for those of you that are unfamiliar with this concept, typically subsidized housing is rental accommodation where the rent is pegged at 30% of the household's income. So there's some variation depending on the programs in the provinces, but we're sitting somewhere around a rent being stuck at 30% of household income. So we recently have had an opportunity to look at some data from the Survey of Household Spending that measured food insecurity, but also enabled us to identify households living in subsidized housing across the country. And here you see the food security status. It's not good. Over half, 51% of households that were living in subsidized housing in this survey, of 450 odd of them, were food insecure, and many of them in the moderate or severe category. So the levels of food insecurity are very concerning. So if I told you nothing else, this picture should be enough to say that we're not doing great in terms of subsidized housing being a solution to food insecurity. Getting into subsidized housing, still seems to be leaving about 1 in 2 food insecure. How come? Well, we've done a bunch of work to try to figure out what's driving food insecurity amongst people living in subsidized housing. And this graph is showing you the probability of food insecurity based on after-tax income. And you can see a kind of a gradual slope. What's the difference between people in subsidized housing who are food secure and those who are food insecure? It's income. As income deteriorates, the probability of being food insecure rises. What's the moral of the story? That we absolutely need to recognize the extraordinary vulnerability of people who are renting to food, their vulnerability to food insecurity. But fixing rent at 30% of income doesn't appear to be the solution to this problem, because it doesn't necessarily ensure that there's enough money left over for food. That depends on income. So in thinking about policies and programs going forward that we could think about, and we should in the context of the National Housing Strategy, thinking about policies and programs to improve housing affordability means identifying programs where the income is adequate to support the rent or the housing cost. Just like owners, renters need to be able to buffer income shocks in order to remain food secure. To summarize very briefly, we've walked through a whole bunch of different socio-demographic or socioeconomic variables that associate with higher odds of food insecurity, and here I'm just giving you our laundry list. Income, social assistance, being a renter, having children, being a lone parent mother, being Aboriginal or Black. We've also, through the research we've been able to do with these survey data, also pinpointed a couple of things that appear to be protective. Relying on seniors' income or being an immigrant, for example. We haven't talked about this other bank of things that we've also taken a look at, but haven't had time to incorporate in this presentation. But we can see no evidence that people's food skills, their use of gardens, or their proximity to food retail is a significant predictor of this problem of food insecurity as it's being measured on the Canadian Community Health Survey.
So the PROOF group is so far offering a single bold solution for the reduction of households' vulnerability to food insecurity, and that is the basic income or the guaranteed annual income. And the work I presented to you on seniors is actually a simulation of what a guaranteed annual income looks like and what it can achieve. And so we're suggesting that having this main source of income being basic income without having some of these other constraints that social systems with assets, etc., would reduce vulnerability, and that the actual increase in income is actually not that great. So in the last fiscal year, this guaranteed annual income equivalent for seniors was basically only $15,800 per year, which is still about twice of some of the unattached social assistance rates. But as you can see here, really can render invisible a huge number of the high prevalence groups in terms of shifting people towards the lower level of food insecurity by virtue of having higher incomes without with stability, which is what a guaranteed income does, and at a slightly higher level. So that's what we're offering as our case for basic income and the data that we presented so far. And we'll turn it over to Pat now, talk about how she's used our data.
Hello, everyone. It's a real pleasure to be part of the webinar today. I'm going to begin my presentation today with a look at just a little bit of history on our path with making a position and taking recommendations regarding food insecurity. And it's the second piece of the title for today's webinar. Our question here is, what does it mean for policy and practice when we as a professional association seek to make a position statement and make recommendations? So our journey is very similar to what many would know in Canada in the 80s, as there was more awareness and advocacy with respect to household food insecurity. Our first position paper talked about hunger and food security. That was 91. 2005, did an update on that one, talked about individual and household food insecurity. And then with another paper in 2007 and Health Canada releasing some information, there was a bit of a gap there, and other things were starting to happen around 2012, especially when the UN Special Rapporteur on the Right to Food visited Canada, and PROOF started to publish its reports around 2013. And the end of this timeline is that we produced our third position paper last year, which we posted in August of 2016. So just very quickly, I gave you a little bit of detail on these. It's important to know that this government-produced report in 2007 did acknowledge in the implications section, tackling income-related food insecurity in a sustainable way will require addressing factors associated with income. So what PROOF is talking about is not actually new. It's not a surprise per se, but what PROOF is giving us is the research to help with their mission, which was identifying policy options to reduce food insecurity. And the UN Special Rapporteur's visit, for me especially working in Dietitians of Canada, that was when I looked hard at our 2005 position and knew that it was coming time to get an update again. Usually position papers last for about 5 years. At that point in time, it was already 7 years, and we needed to start thinking about that. Interestingly, that visit highlighted the language of human right to adequate food. And it also, if you look at what was in the report from Olivier de Schutter, it talked specifically about food insecurity amongst our Indigenous peoples in Canada. In 2012, fortuitously, there were a group of keen dietitians with some funding from the Canadian Foundation for Dietetic Research who looked at, across Canada, what were dietitians saying about food insecurity. Here we see that largely, this is 5 years ago, dietitians totally understood that it was about the quantity and quality of food. That was part of the definition. And there was emerging awareness about food as a basic human right. Big agreement when they were asked about sort of the top 3 causes of food insecurity. Huge understanding that this was very much income inadequacy and factors contributed from food prices and housing. This is the next piece. Effectively addressing household food insecurity is the piece that reflects our professional dilemmas, some of the angst that dietitians experience when they really become aware of household food insecurity, its prevalence and severity, and think about what that means in their actual practice. So here we see some disparity. While there was belief that short-term relief solutions were not really great, effective ways to address household food insecurity, 29% said there was some addressing that would happen through short-term relief responses. And in fact, 38% were doing some work within that setting. Capacity building in the community, a higher number thinking that there was some effectiveness in addressing household food insecurity there. 45% participating in their actual practice. And what I really want you to look at is system change. 88% of dietitians, they knew that system change was ultimately going to be the effective way to address household food insecurity. And here we mean, of course, people having access to food through adequate incomes. But only 18% felt that they were doing something about that in their actual practice. Lots of factors contributed to that. The immediacy of individual client needs, remembering that dietitians are health professionals, and so in our contact with client populations, that definitely pushes up the urgency for getting clients connected with short-term relief, but also advocating in the longer term for clientele. Some people spoke of lack of knowledge, skill, confidence, and in particular, there was mention of lack of employer support, because I think then and still today, there are elements of household food insecurity that are regarded as highly political, that it's almost like a lobby when you say that the long-term solution is for the government to figure out how to make sure that income is adequate for people. Asked about the role for professional associations, the dietitians who were polled in 2012 talked about looking for some clarity about appropriate roles, and that the association in particular, they hoped, would be lobbying government and putting out clear position statements. On the strength of that, there we go. Around 2013, Elaine Power agreed that she would update the paper that she largely wrote in 2005. And we had some other contributing authors. We had an advisory committee sort of driving the path, 19 DC members. And yeah, you can read this in the acknowledgements page that I have a fuzzy representation of in the bottom corner, but at least 60 members contributed to various reviews. A couple of networks contributed, people in government departments. We had updates for members. We did presentations every year at the annual national conference, and those presentations come up on Learning on Demand in the members' website. So there was a lot going on in those 3 years, and I will confess, as a staff person who was trying to lead this through, my question often was, when will we finish this paper? And I'm sure the advisory committee felt the same way. But remember that you need to be sensitive to the political environment and to the changing environment. If you're going to write a paper that is worth its salt, then you have to be flexible in the process and sensitive to what's emerging from other stakeholders in this area. So PROOF was publishing annually. There were more surveys available about situations within and amongst Indigenous peoples, like the First Nations Food and Nutrition Environment Survey. I believe 3-4 provinces had published by the time we finished in 2016. CCHS, CHMS, these are national surveys. The Mental Health Commission was going strong, really raising awareness about the connection with mental health and household food insecurity becoming more important because of raised awareness about mental health. We were engaging DC members, and we were committed to making official recommendations, which is something that we didn't really do in the earlier papers. And this was, again, part of the challenge for us. At what point had we written about the literature and what we knew, And then would we stick out our necks and say something that really effectively was official recommendations of the association. August 2016, two major papers, the backgrounder and the other one called Position Statement and Recommendations, and then a third one, the Executive Summary. And we have a very easy URL for calling up this information, but I see it's divided on the slide. It's www.dietitians.ca/food insecurity, one word. And this is also some snapshots from the website. And I just wanted to point out that mutually with OSN-PPH and the work that they published on income-related policy recommendations, we endorsed each other's papers. So you'll see the top is the OSN-PPH paper, which we endorsed. And then further down, look for the logo in the sort of bottom right-hand corner of the collection. And you'll see that that group in turn endorsed the DC paper. And we're still accepting endorsements. We're happy to put them up on the website. So here's a quick description of what we produced in 2016. So the first paper, there's the title. I refer to it as the backgrounder. And this is essentially the table of contents in brief. We included language on the right to food. We took some time to really be specific about definitions, talking about marginal food insecurity, because that was definitely an issue that was becoming more important as people were studying the information from PROOF. The relationship according to the literature and what we knew about income, what we knew about physical and mental health consequences. And then we looked at the different populations. And here, with inspiration from the Special Rapporteur, we made sure that we added a special focus on Indigenous peoples and their food insecurity situations. So in essence, with this paper, we achieved an updated lit review and we added focus on Indigenous peoples. And then the second document, this is where we publish the position statement. We talk about poverty and household food insecurity, how they're connected, the concerns of health professionals, the fact that these are costly health issues. So this is really the language of dietitians. This is what you would expect from an association of dietitians, that we would talk about our concerns as health professionals. And then as we started to take the evidence for action, and I say very sincerely, thank you, PROOF, because indeed PROOF came through with a lot of great evidence for action. And we organized that into 4 basic areas where we then made our recommendations after each section. And so that was achieving that other goal that we had of making recommendations. So our first recommendation is about income-based strategies. The second one addresses the unique challenges of Indigenous peoples. The third recommendation is what we say about the need for monitoring and reporting of household food insecurity in Canada. And the fourth on research gaps. And then in this paper, there's a summary of all the recommendations at the end. And for the faint of heart, if you don't want to read those big documents, we made an executive summary. That's the only fair thing to do. It has the entire position statement. It has all the text of the recommendations, and in between a mercifully short little piece that tries to summarize the key points from both the backgrounder and the literature that we cite in the second paper. So here's our position statement, very simple, 2 sentences. The first sentence, focusing on health impacts. We think it's a serious public health issue with profound effects on physical and mental health and social well-being. And Val will be telling you a little bit more later on about work that they have done in that area and more that they can share. And then our second sentence very simply says, this is the solution. All households must have sufficient income. And here then I'm just going to quickly go through our 4 recommendations. I've essentially taken the red text directly from the paper. I've highlighted the words so that we can quickly go through these. The first recommendation is very much like what OSNPPH, the Ontario Group of Public Health Dietitians, published in November of 2015. This is the income-related piece. So we are, as Dietitians of Canada, recommending pan-Canadian government-led strategy. When I say pan-Canadian, we are really trying hard to say to the federal government they need to provide some leadership and direction and funding, but it's also obviously going to be something that the provincial and territorial governments have to work on. So we have poverty reduction strategies, different strategies at different levels, and these need to come together and be coordinated and comprehensive and form that pan-Canadian strategy. And all of the elements included in there. And that's what I've summarized in the black points. The second recommendation, again, the red text is what we said specifically. We talked about these being additional and unique challenges. So obviously, whether you're of Indigenous ancestry or any other background, if you're poor, you're poor. And some of that makes it the same, but there are many additional and unique factors contributing here in this picture. And so those were the ones that we sought to identify over and above recommendation number 1. And we talked about the Truth and Reconciliation Commission, UNDRIP, the United Nations Declaration on the Rights of Indigenous Peoples, resolution of land and resource disputes, looking at traditional and country foods, what were the supports, what were the barriers, store-bought and market foods, the fact that access is limited on some reserves in some of the remote communities in Canada where there's a high percentage of Indigenous peoples living, and then some of the inequities that we understand are present in terms of education and employment. Third, this is something that we thought was really important to say because PROOF can't say it on their own necessarily. I mean, Val's team received CIHR funding to do a huge project, but what we are saying here is that this kind of work needs to continue. So recommendation 3 and 4 are really getting at the whole piece about if we don't have information, how do we talk about it and make it real? So we wanted to advocate here to the government to say that anything to do with the measurement of prevalence and severity of household food insecurity had to be all the provinces and territories. It had to be mandatory. It had to be regular, annual, or every 2 years monitoring and reporting, and that this would be very critical in the impact and outcome evaluation of whatever strategies were implemented. And of course, number 4, I feel like we always put this at the end. We're so evidence-based in our profession that we're always talking about the need for continued research, but it's true. We need to understand more about which populations are vulnerable, what the social, political, and healthcare costs are. And when we talk about income-based policy responses, we can't help but talk about what are the alternatives, because if we don't have a good income-based policy solution now, the alternative is that we carry on the back of the healthcare system, a system that is out of control in terms of costs. Those costs are true costs. So can we even afford to not have income-based solutions? That would be the argument that we would put forward. And then always, and we do this in our current advocacy work, talking about any kind of policy on poverty reduction, that there must be a measured impact on household food insecurity and on health outcomes, or it is not a poverty reduction strategy that we consider to be successful. So going back to 2012 and the dietitians who were polled, and what they said was a role for professional associations, They wanted clarity about roles for dietitians. We've discussed it, but we haven't published an official paper. That paper is under construction. And they wanted lobbying of government and position statements, and we have done that. I'm really proud of the work that we've done in Dietitians of Canada. Even before we published the paper, as we were engaging and working on the paper, we produced an election toolkit with the federal election in 2015, and there have been equivalents at the provincial levels. Provincially and federally, we give pre-budget submissions where we talk about food insecurity. We contributed to social assistance reviews in some provinces, and the list goes on. We've made an official submission to Nutrition North Canada talking about the need to address the most vulnerable with the Nutrition North Canada program. And currently underway are consultations on healthy eating strategy, which is different than addressing a solution for food insecurity, but we talk about it nevertheless within the realm of the different consultations in that package, and then more directly within the current work that is being consulted on for poverty reduction, the national food policy, that's coming up soon, letters and discussions that we write, and having our DC representatives at policy tables. So that, in a nutshell, is our work as a professional association and how we as a collection of members are responding to household food insecurity issues.
Thanks very much, Pat. We've just got a couple more slides to show you before we move to the question period here. First of all, word from our sponsor. Proof is many things and many people, not just me. And if you're at all interested in the research that we've been presenting, or you are interested in getting your hands on those infographics or things, please take a look at our website. And you'll find all sorts of resources there, both research papers as well as more user-friendly things. As we were preparing this webinar, we realized that we had too much content, and we ended up lifting our slides and information about health and food insecurity out of the webinar, just so that we could do justice to the conversations about income and housing issues. But Lynn and I have decided that what we really need to do is webinar number 3. So we haven't got a date yet. We're looking at sometime in May. But if you're interested in hearing more about the research on food insecurity in relationship to health and nutrition, please keep an eye open for notices related to this webinar. Okay, Craig, back to you.
Thank you, Val. Let's now move to our questions. We had quite a few questions, comments come in during those amazing presentations, and I'm going to start with a few questions that are particularly for Val and Lynn. And Mary is asking, do seniors also receive social assistance, and if so, what types, and how does that relate to the messages that you were delivering?
Yes, I tried to answer that as I was going ahead. So in fact, you become ineligible for the traditional provincial or municipal social assistance when you become at age 65 because of the senior benefits, and that's part of our Canadian plan for seniors. So the entire work of the guaranteed annual income simulation of the guaranteed income supplement and the old age security is why you have that population that does not have social assistance in their income supports. It's actually all related to the senior benefits that we all buy into in Canada. So that's why it's a very interesting example of a guaranteed annual income or basic income.
Interesting. Thank you, Lynn. Angela is asking, do we know what proportion of household incomes are being spent on food and regional variations of this?
So if I can answer that as well. So one of my former postdocs, Olayemi Olabiyi, did a study of the political economy of food insecurity, and I'm looking at his slides right now. So very interestingly, as of 2009 data for both Canada and the United States, the lowest 20% of the population, both in Canada and the United States, spend 16.2% of their household budget on food expenditure. And this contrasts to, in Canada, the highest 20% spending 11% of their income on food expenditures, and the U.S., where it's lower for those, it's only 7.5%. So that is So 16% is quite a bit of a budget for the lowest income, but it's still relatively cheap. The food is the issue of the food. It's not necessarily the prices as much as the other costs of basic living, and particularly housing and some transportation, etc. But it's a very, very good question, and we need to watch food prices as we have have had food prices shocks before. In terms of regional variation, I think the cost of eating studies have shown nicely that there are some retail differences. So obviously, from one urban center to another, a rural center to another, a corner store to another. These are actually minor, but they make a big difference when people have very few dollars left over to buy food. But that's, I think, a very helpful question. I was really glad when I read the question to scramble and find really in these slides on that.
Thank you, Lynn. Now Richard has asked, is increased risk of being food insecure for families in subsidized housing related partly to being forced to rely primarily on precarious income?
I don't think so. I mean, there are a whole lot of criteria in terms of who gets into subsidized housing, but when the study that I showed you a couple of slides from is soon to come out in the Canadian Journal of Public Health, and you'll see in there an itemization of the sources of income for those people, and most of them are not in the workforce. In that case, there are people on seniors' incomes and people on social assistance. So it's a mixed bag. So it doesn't, I mean, in our examination of what was driving vulnerability within that group, and we were able to do that, right, because we've got half of them food insecure and half of them not food insecure. But in our examination of that, the kinds of things that we're associating with food security were that seniors' income and that basically the overall higher rates of income.
Great, thanks, Val. I'm going to ask now a few questions that are really particularly pertaining to Indigenous populations. I've got a really comprehensive question by Nancy. It's got 7 pieces to it. I'm going to read them through, and I'm not sure we'll be able to answer them all sort of in sequence, but I'll read them all out so you get a sense of what Nancy is inquiring about. So does detailed data exist on the Indigenous population, on the number of single income families, number of children per household, home ownership versus rental, household composition, level of income, social assistance versus cost of living, income sources, OAS, etc., and is this the same as the Canadian population, and cost of a household food basket versus income. So that was quite a lot of questions, and did you want to, the three of you, want to take an attempt at answering some or all of those? Let me know if you want me to repeat them at any point.
Mm-hmm. If I could jump in, it's Pat. We took some time to look at the literature that was available to us and looked specifically at the emerging survey results from, certainly from the First Nations Nutrition and Food and Nutrition Environmental Surveys. That was with regard to First Nations on reserve. And also the Inuit Health Study, and I think there was another one called the Indigenous Peoples Survey. And where we could, we pulled out the kind of information that you're asking about, Nancy, and we talked about that, and you will find that in the Dietitians of Canada paper in the backgrounder, where we talk more about the Indigenous peoples as one of the vulnerable populations disproportionately affected by household food insecurity. And the answer is that certainly you see the impact of housing there, you see the health differences, and so much of it really is very similar to scenarios where in the more urbanized, shall we say, parts of Canada, where, by the way, a good half of our Indigenous people also live, but it's quite similar around the income pieces. The problem is low income, but then you get that added layer of time and money, so to speak, the pursuit of getting traditional and country foods into the diet, which we associate with healthier diets. For those who want that in their diet, who are living closer to the land, it's not just income, but it's the time that you have and enough income to get you properly outfitted so that you can then go out to hunt, to fish, that you have access to land so that you can do gathering or cultivation. That's, yeah, if you look for the Indigenous sections in the focus of the backgrounder and also in the explanation about recommendation number 2 in our second paper, that's where you'll find that information.
Thank you, Pat. Val and Lynn, do you have anything to add in that cluster of questions?
I don't.
I guess what I would add is that, yes, members of the Indigenous community in Canada are eligible for all of Canada's benefits, so that the Old Age Security Guaranteed Income Supplement actually provides a very, very important income source for vulnerable Indigenous households wherever they live, if there's a senior or an elder in the house. But I think Pat said it very well, so that all of the vulnerabilities that we see in mainstream Canadians are there, particularly the income, and then we add the genuine difficulties of access to food and the assorted high prices of food, and larger family size and extended family, etc. And this is an extremely worrisome problem that does need very significant policy attention. And I think it's been lost somewhat in the discussions around housing, water, etc. But I think the food has to come back as a major policy intervention as well, particularly in the north. We've been showing these alarming rates of Nunavut, and that is only one example of absolutely a huge disparity in Canada that needs to be attended to. And I go back to what Pat said: start with income, and then understand the other perturbances in that situation.
I should add that, and it's Pat again, the inequities piece around healthcare delivery, education, access to programs like, well, access to education, what we take for granted as a population in general, we understand more and more that there are limitations in how some of these programs are set up. Much of the funding for Indigenous people's services comes directly from the federal government, and so we're starting to see some inequities there. They've been talked about before, but I think they're certainly coming to the fore. Much of this is as a result of the challenges after we heard the testimonies in the Truth and Reconciliation Commission, and in our submission to Nutrition North Canada, we made a big point there to say, hey, right now you're subsidizing the cost of fresh food in the north, but there are some people working in the north who get subsidies. They get it through their income tax. They may even get a sort of a bonus for living in a remote land, and others who live there permanently who don't have access to that kind of extra income help to deal with the high cost of food in the area. So we really have challenged Nutrition North Canada to think hard about how their program benefits people who are particularly food insecure.
Interesting. Thank you. Thanks, Lynn and Pat. Now, I've got a question from Shirley, and I think that Pat and Lynn, you may have partially answered this, but perhaps you'd like to reiterate and then expand if necessary. Shirley is asking, how do we really consider food insecurity for First Nations and Aboriginal people when there are few food security surveys on reserves, as Stats Canada does not survey households on reserve?
So and that's what the FNS and ES surveys were about, and they were commissioned by First Nations themselves. So yeah, really this is about making sure some of those gaps are filled.
I would add this, it's the same thing. So the PROOF project, because it relies so heavily on the Household Food Security Survey module as the measure of food insecurity, which is only appearing in the Canadian Community Health Survey, and only therefore does Indigenous families that are captured. There has been the attempt to actually harmonize some of the surveys, but the Inuit Health Survey, Aboriginal People Survey, First Nations, these are actually run indigenously. And so I think the encouragement would be to harmonize the measure and the analysis, recognizing the particular vulnerabilities that are unique in terms of the genuine access in a remote area.
Great, thanks very much. I've got a question that I think all three of you may want to answer, a few of them in fact. Tara's asking, is it true that the rates of food insecurity among seniors are rising? She had read recently that is now actually at about 12%, and those seniors who don't have assets, homes, cars, RSPs, etc., she thinks must be worse off than those seniors who do have those assets. Comments from any of the three of you?
So I'm here. I've been reading the popular press, but I haven't actually seen the data of 12%. Val, can you comment?
No, I can't. I mean, what we can see when we have broken open the seniors' incomes, like the study that Lynn showed results from in this presentation was focused on very low-income seniors. But when we've looked at broader populations, like, for example, the work we did in British Columbia or the work we've recently done in Ontario, and when we look at seniors in general, we see a lower rate of food insecurity. If we break them open and we separate those who are reliant primarily on public pensions from those that are more reliant on private retirement income sources or private pensions or investments, we can for sure see a difference, whereby the ones on public sources have higher risks of food insecurity than those relying on private incomes. And that makes sense, right? Because ultimately they're more wealthy, and those private incomes are signals that these people have way more assets. As we see more of the population migrate towards public pensions, we're going to see fewer, and that is what's happening in Canada from our vantage point at least. We will see some shift, but I think we're a long way from 12%. I mean, I'd be interested in knowing where that came from, and certainly if anyone would like to follow up with an email, it would be very helpful for us to be aware of that work. But yeah, my sense is that for sure there has always been a separation between the vulnerability of people who are so wealthy that they are not reliant on things like the OAS and GIS, but 12% takes us close to the national level that's 12.6, and so I'd be skeptical of that.
Thanks, Val. Question for Pat. Morgan is asking, will there be a similar update and expansion of the Community Food Survey position statement from 2007?
You noticed that I sort of jumped over that one, hey? One thing at a time in our little organization. We are small and mighty, but we do get burnt out. We are looking at what to do with the community food security paper. There's lots of good stuff in there, but it's 10 years old, and I have been tempted to take it down, and yet we don't have a replacement for it. So quite honestly, I don't have an answer for you. We are looking right now at a little bit more work on sustainable food systems in general, and looking at how sustainable diets fit in with our definition of healthy eating, and that really takes some of what the community food security paper was talking about at the local level. What do we say about local food? How do we promote access to and self-reliance on the food that we grow here in Canada? And that's why I'm really interested in what's evolving with the recent work going into the national consultation on national food policy. But do we have concrete plans to update the 2007 paper? No, I suspect it will come down at some point, and it will be replaced with other statements that pull from aspects that were addressed in 2007. I have to be truthful. I think we all need to be careful. It's been discussed before. How do we talk about food insecurity? And the emphasis needs to be on the income-based solutions, and much as community-based food security is really important in communities, it's important in different ways than what we're talking about in today's webinar, where we are looking at the prevalence across the country, where it's very much tied to income. So the food-based pieces, aside from emergency food relief, those food-based pieces and how we talk about food security as a country and in our communities, that I think is going to take a slightly different slant now.
Thanks, Pat. We've got a question now that all three of you may like to participate in responding to, and that is, just to make it clear for everybody, we're being asked by Bobby, what's the difference between community food security and household food security?
I'll start. It's an important question, and it's a tough one. And it preoccupied much of our discussion in the first webinar as well. When we're using the term household food insecurity, we're absolutely talking about that 4 million and counting Canadians living in households that responded affirmatively to at least one of those god-awful 18 questions on that module that began this presentation today. And so we're, people who are worried about running out of food, compromising the quality of the food that they eat or that they feed their children, and skipping meals, cutting meals, going hungry without eating. So we're talking about very, very significant problems of accessing food because of financial constraints. So that's household food insecurity. And I can't emphasize enough how important it is to keep our eye on the ball. I think in the last webinar we showed that broad definition of food security that is the FAO definition of all people at all times with access to sufficient, safe, culturally appropriate, whatever food for productive lives. That broad definition of food security, I think, has been expressed in ways related to the level of food insecurity at a national level or a provincial level or a community level. But it's speaking about the conditions overall. Honestly, I think that we are a long way from being very clear on how and when these two ideas even should be on the same table. But for me, it's really, really important that we recognize that household food insecurity isn't an indicator of community food insecurity or community food security. It isn't. Those things are separate, and that this thing is about economic access. But I'll stop there. Lynn and Pat, I know you both have things to say, and maybe you'll help to clarify these distinctions.
Pat, did you want to go next?
Yeah. These topics are emotionally charged because it's often semantics. So if I was to say personally what I think makes for stronger community food security, I would be thinking about a community at its local level that has some good grocery stores, that those stores would be on bus routes, that everybody knows where good food is available, that the pricing is fair, that there's some local agriculture around, that in fact some of the food that the community is eating is coming from close by. If the world shut down and there was no gasoline for cars, that there would still be food production in the local area. That indeed would make a community feel secure about its food. And there is a piece where that overlaps with household food insecurity, if you will, in that the households with very low income are particularly challenged if they happen to live in a part of a community where it's really prohibitive to get to that good grocery store, and they may in fact, because of income challenges, be shopping at a corner store where the prices are higher, and it's easy then to get into a situation where you conflate the two. But we really need to think about what are communities doing to promote healthy eating and good food access, access to good food that is nutritious and safe. And that would be primarily what we talk about in even the federal strategy, healthy eating strategy. That would be the community and sort of the locale piece. Food environments, that's another piece that we're talking more about. But within the household, that is the income piece, where they are so affected by their limited resources that the impact is to the extent that there's high anxiety, that there is difficulty having enough and good enough food on the table on a consistent basis. And that's a different situation than when you look at the community as a whole. Do they have stores? Is there agriculture nearby? How do they rely on the food system in general? So that's why I tried to sort of look at sustainable food systems, some of that food environment piece, promotion of healthy eating, really valuable activities, but let's name them for what they are.
So I think these last two comments have really helped. And all I want to add is that I'm not sure that we even need to have community food security as a term anymore. When we have a very, very robust dialogue around sustainable food systems, around food sovereignty issues, around local foods and healthy foods and a food policy framework, then these are all very important policy goals that have food and agriculture and agri-food as the center. And what we say in the Household Food Insecurity, with the way we operationalize it as an inadequate income, we don't really need to be part of that inclusion. And it's actually been harming the whole analysis by having too much of the community food security attempting to provide food to those that are food insecure, as if that will render them less food insecure, and that's not so. So I think the community is as a part of the entire food system, and many of these very animated and important dialogues that are going on from the federal, international level, locally, provincially, they could actually just step aside from having to conflate, as we've been using the term, to mix the idea of the households need income, and as Pat said, the nexus is when they are the most vulnerable in a food security threatened situation. That's really the only time that they two come together. I think work very diligently on having healthy food systems, and that's good for the planet and it's good for all. But I think let us all have first and foremost that income is the way that people acquire their food largely outside of the country food area.
Yeah. There's no doubt that emergency food relief, if you think about a situation where you have an earthquake or something that is really a disaster, then food, physical food, is the solution to the problem that's immediately there. But for this chronic problem that is connected to low income, do we really want these households to think that they in part are relying on essentially a whole different layer in the food system, this layer of food charity that was created, intended for emergency food relief, which has now almost become like another piece within our food system, which it was never intended to be. And quite frankly, it's almost a crazy thing to be doing. We buy our food donations with our net income and we donate them to the food bank. We could be donating money to charitable causes and getting some tax receipts and sort of making our money even bigger. But we have this odd way of donating food to the food banks and then thinking that that distribution somehow makes a help. But especially speaking for dietitians, and remember back to that survey in 2012, when you're faced with someone whose cupboards are essentially empty and you're a healthcare provider, of course you want to do what you can in the immediate. And that's where it's really, it's common then for health professionals to focus on the immediate need as well as the big policy picture response. bit frustrating perhaps that our association chooses to emphasize the policy response, but I believe at the association level that is indeed the role that we need to take.
Great. Thanks, all of you. Now, I have a question from Andrea that's a little bit slightly different topic, and that is she suspects you may address this in webinar number 3, which we shall see, but I wonder if you could tell us a bit about the relationship between food insecurity and mental health.
I guess, Val, you must be waiting for me. Okay, so very, because I know we're coming to the end, very briefly. So very, very, very strong relationship between food insecurity and mental health. The relationship, in fact, could also be considered bidirectional, that food insecurity is such a stressor that it actually leads to genuine mental health problems that can be diagnosed by a professional. But on the other hand, having a mental health problem is quite disabling to all of the coping strategies and animation that's required in order to retain the food security of a household, particularly one in straitened circumstances. We find this for men, for women, for children, for youth, very much over the long term. We find it's a very, very severe mental health problems, and so it is. And I guess the important finding is that it appears to be far more the stress of the food insecurity experience that is the contributor to the mental health problem than nutrient intake problems or other types of physiological explanations from the food itself. So I think that's really important final message, is that this experience of deep poverty that's related to food insecurity is profoundly stressful, chronically stressful, with acute stress on top of it for all members of the household. And that's why I think we care about it as being a human right that's been violated, and also its huge health consequences.
Great, thanks, Lynn. Now, at the risk of going a minute or two over time, I do want to ask one more question. There are several really great questions that we haven't had time to answer. We will answer all, and we'll do that afterwards to make those responses available online on CDPAC's website, along with recording of the webinar. But the last question that I want to ask that was posed by hang on, I lost track of it, excuse me, ever so briefly. It was dealing with the prices of housing, and not only here, excuse me, Lillian is asking, what are your thoughts on the rising housing costs and increasing level of homelessness and expected food insecurity in some of the major cities, such as Vancouver and Toronto, as well as the North, in relation to food security and possible policies moving forward? Is there a place for housing policies as a strategy to reducing food insecurity?
Just quickly, I'm sure Lynn will make a comment as well, but just to say that we've done quite a lot of work now to look at the experience of people who are renters and to try to make sense out of the relationship of their rent payments to their vulnerability to food insecurity. And honestly, as the longer we work on this, and it's for sure an evolving thing, I mean, this is emerging research, and much of what I know is not something that we've even published yet, but the longer I work in this area, the more I'm coming back to income as opposed to housing policy per se, that it seems like whatever the housing circumstances are and whatever the housing market provides, you know, and whatever it does in terms of making available a low-cost rental accommodation for people, it's imperative that income transfer programs be pegged in ways that enable those people to pay those rents, whatever they are. And so if I think about going back to the examples today, the seniors' incomes, the Newfoundland poverty reduction story, you know, over and over again, and maybe we haven't emphasized it, but we've used the word indexation. And increasingly I'm thinking that as we watch this crazy, you know, in Toronto, the housing bubble or whatever we've got going on here, as we watch this stuff unfold and think about its implications for people in the rental market, and particularly low-income people, it's imperative that we have that thought, you know, integrated into any sort of income assistance or benefit levels, like, for example, that famous child benefit we've heard about, right? You know, we need to make sure that these things are designed in ways that any income supports we're providing to low-income Canadians actually are sufficient for them to manage these markets. Lynn, over to you.
So this is actually, it's not obvious what the right answer is. Absolutely the income is one, but every time we've written a paper and added rent control as one of the possible solutions, those that actually have more experience than we have actually challenged that. So it's not, these are not easy solutions. We need to have at the higher level, why are we pushing this pro-housing, particularly pro-single family housing, low density type of approach? It's not good for the environment, it's not good for climate change, and it's also not very good for this, the housing bubbles. The other is we should be watching some of the experiments we're seeing in places like Vancouver, where they're working on the foreign buyer and the taxation, etc., and the vacant properties. So I think we need to have a larger panoply of solutions here. And then we also have to think about what kind of a rent relief strategy could we have with a shock in the renting side, almost similar to some of the forgivable mortgages of Canadian Mortgage and Housing, etc., so that we could actually rebalance the absolute disadvantage of renters. But it's not as easy to say rent control, affordable housing, more units, Habitat for Humanity. That's actually, these are big, big macro problems, and we need to shift, I think, our homeowner culture as a starting place for policy, and then work our way down on the actual locale and a type of housing tenure.
And I would go back to one of the recommendations from our Dietitians of Canada papers, that whatever the policy approach chosen, we need to look at the impact on food insecurity, because at the end of the day, if you're just looking at parameters like income and housing and the spreadsheet of the numbers, what really counts is whatever the household, do they have food on the table? Are they anxious about where their food will come from at the end of the day? So no matter what the financial picture looks like on paper, the really telltale sign at the end of that crack the whip game is, do you have money and security to have food in your household? And that's kind of why I really want to emphasize that we need the food insecurity information, because no policy should be deemed successful if the people are still experiencing household food insecurity.
Thank you. And Pat, those are really great final words. I wanted to thank our speakers very much. Valerie Tarasek from U of T, Lynn McIntyre at University of Calgary, and Pat Vanderkooy with DC and CDPAC. Now, as Val mentioned, she and CDPAC will be co-hosting a third PROOF webinar, so stay tuned for the date and the descriptor for that. And a special thanks to all of you in the audience for your attention and interest and your questions. We're so glad that you could join us today. So thank you and goodbye for now.